You're listening to Chat with the Experts, brought to you by Angie's List on 93 WIBC.
Welcome to Chat with the Experts, brought to you by Angie's List. My name is Kyle Hawk, and as always, I'll be your host today. I want to thank you for joining us as we get you filled in on a number of topics ranging from home improvement to lifestyle and health. We get all of our information on the show straight from qualified service providers. Last week, we had a really good one. We welcomed Greg Mrakich of Greg Mrakich Painting here in Indianapolis onto the show. Talk with us about interior and exterior painting, wallpaper removal, what equipment to use, and a whole lot more. If you missed it, you can find that episode by downloading our podcast. Just go to iTunes, pull up iTunes on your home computer, or download the podcast app on your smartphone. Search Chat with the Experts. You'll find all of our back episodes, including our most recent one. And if you hit the subscribe button, you can stay up to date on every single show as we release it. You can also, of course, find us at angieslist.com. And this is where you're going to get helpful reviews of service providers and health practitioners in your area. If you join today, be sure to use the promo code WIBC40. You're going to get an additional 40% off an annual membership, and annual memberships are under $10, so it's a deal you don't want to miss out on. Visit today and hit join now at angieslist.com. Well, before we get into today's topic, we want to let you know that for the past almost a year and a half now, we've been broadcasting at 9 a.m. here on WIBC. Starting next week, next Sunday, September 6th, we're going to be moving to 8 a.m. So all you have to do is get up an hour earlier, and we'll be going from 8 to 9 a.m. right here, same station, WIBC. So tune in and listen to Chat with the Experts. You know, we cover a lot of topics on the show, but perhaps none of them are quite as important as your health. And earlier this year, we welcomed Dr. Scott Renshaw of IU Health onto the show to talk with us about choosing the right family doctor and what to expect. And today we're going to be talking about your health once again. This time we're focusing on the importance of preventive measures and what you can do to ensure that you and your family stay healthy. And as we've discussed here before, having good health starts with regular trips to your doctor. And today we're going to investigate the importance of preventive services. So joining us once again to talk with us about this very important subject is Dr. Scott Renshaw. He specializes in family medicine with IU Health right here in Indianapolis. He's a graduate of the IU School of Medicine. He's been practicing for over a decade, earning numerous honors and awards. We're going to talk with him about the importance of preventive health care and what you can do to relieve stress. Dr. Renshaw, thanks for coming back on the show today.
You're welcome.
I would be remiss if we didn't touch on this before getting into our main topic today. I wanted to ask you, how are Henrietta and the Cluckers?
They are doing fine. Their egg production has decreased a little bit. They're getting more elderly in as chickens age, unfortunately. Their egg production drops. But we still get a couple a day, so yeah.
That's excellent. Well, one of the most exciting moments of our show this year has been Dr. Renshaw sharing with us when he came on earlier talking about the chickens in his backyard. And so I had to check in and make sure everything was going all right there.
I'm impressed you remember that.
Yeah. Well, we're going to get into today's topic. I wanted to ask, I imagine this time of year with, back to school happening, business kind of perks up a bit with a lot of people bringing their kids in for shots and doing preventive care to get ready for the school year. Have you noticed that?
Oh, sure. Now is the kind of the back to school time, sports physical time, getting your shots up to date so the kiddos can be healthy to start school. Sure.
Yeah. Well, a big part of all this is preventive care. And when we had you on before earlier this year, we talked about choosing the right doctor. But what we want to talk about today is what do you do once you have your doctor to stay healthy? What are, just some of the basic services you should be taking advantage of from your doctor?
Sure. Well, I think keeping that yearly, if you're healthy, no other medical problems, I think keeping that yearly checkup, even though there are no medical problems, like I said last year, I think it's a good idea to check in once a year. The whole point of that is to prevent things. So if your doctor can find them early, that's usually a good thing. Doctors usually are pretty smart people, so listen what they tell you to do. A lot of times it's pretty good advice as well. So, yeah.
We've mentioned the term preventive healthcare. We're going to talk about that a lot today. What constitutes an actual preventive service? What are some examples of that?
Sure. So prevention is looking for diseases before there are any symptoms or any other way you would know besides running a test. So preventative services might be checking your cholesterol. If you don't know you have high cholesterol, checking it for the first time could be considered preventative services.
Okay.
For a lady, screening for breast cancer, doing a mammogram. If a lady doesn't feel any lumps or bumps in her breast, getting the screening mammogram could be considered preventative services.
Sure. Yep. So are a lot of these things going to be covered in my yearly checkup, or do I need to ask for certain things? Like I know I'm having cholesterol problems. Can we check on that? I mean, how does that work?
Yeah, sure. So that's a bit tricky, just based on insurance and who pays what. But preventative. Your preventative annual exam should include all of the above.
Yeah.
Right.
So just to kind of separate out some terms, I think a lot of people hear these terms a lot, and you may not know exactly what everything means. What's the difference between something like a diagnostic service and then a preventative service?
Sure. So I think the easiest way to think about that, a diagnostic service is based on a symptom or you're going after a diagnosis, or you have a prior diagnosis and you're following up on that. So for instance, maybe if you have diabetes, a diagnostic service would be checking a test called the hemoglobin A1C, which is the test we monitor. Now, if you're healthy, don't know you have diabetes, and you're going in for your annual exam and your doctor decides to screen you for diabetes, then in that case, that hemoglobin A1C test could be considered preventative because we don't know that you have it and you have no symptoms, so we're screening.
Yeah.
Yep.
As we talk about this, it seems to me that the best way to know what exact services you're going to need or having that regular relationship with your doctor where you're going in for your checkups, because otherwise you're in a position of not really knowing what you need.
Sure, exactly, because a lot of that is depending on risk factors such as age, gender, do you smoke, those kind of things all determine what kind of preventative services you would benefit from.
Right. And when we talk about preventative services, one thing that obviously comes to mind is what's going to be covered by my insurance. And this is going to differ from person to person, I can imagine. But, what is your take when people think about preventive services? Are they looking at a big cost, or how does that generally work?
Well, most insurances now with kind of the onset of the Affordable Care Act and some changes in the insurance and medical world, most of those preventative services are covered. The trick is it has to be a preventative service. So sometimes patients will come into my office and they're here for their annual exam, but they also want to talk about, let's say, their big toe pain.
Okay.
Well, that's tricky because their preventative portion of that might be covered by their insurance, but the big toe pain, because it's not preventative now, is not. So when that gets bundled up and packaged and billed out to insurance, a lot of times patients, that's not covered.
Yeah.
So it's important to kind of ask some of those questions and know what your insurance covers before you go to that kind of annual wellness exam. Usually I recommend, again, this is very insurance specific, but I typically recommend an annual exam is a wellness exam. That's not the time to talk about your big toe pain unless you want to pay kind of extra for that.
Right.
So unfortunately, it's the way that works.
Do you find a lot of people coming in and not necessarily knowing already how to separate those things out?
Yeah, that happens a lot. So I kind of have to I mean, it's kind of a fine line because I want to take care of people. I don't want them to miss a bunch of work and have to take off work and find babysitters and all that kind of stuff. But at the same point, I don't want them to get stuck with a big bill, because if they do kind of combine things, when I do bill, because I have to bill it ethically, I can't lie on the bill, right?
Sure.
I mean, I have to bill what we did. When that hits insurance's radar screen, then it usually dings back, and then there's a cost, and the patients are emailing or calling back saying, I thought this was for my annual exam. Well, it was, but it wasn't.
Right.
So it's kind of tough, right?
So the best way up front is to talk with your insurance company or your insurance agent and go over what's going to be covered?
Yeah, I would say know your insurance and know what is covered and how it's covered, and then based on that, you can, inform your doctor and say, I'm here for my annual exam, and that's what we're going to do today, or whatever the case may be, right?
Yeah, that can be a huge part of, kind of handling your services and knowing what you're getting when you walk into the doctor's office.
Right.
We start off talking about back to school, and, children are a big part of this equation when we talk about preventative services. What services do kids need in that realm? What can I expect my child to receive when I take them in?
Yeah, typically it depends. I mean, if your child is an infant or a toddler, a lot of developmental screening will happen to make sure they're growing, developing as they should. Immunizations are huge, obviously, that time of life. As kids get a little bit older, adolescents and those kind of things, there's still some immunizations. I sort of talk about the sex, drug, and rock and roll talk.
Okay.
We sort of talk about healthy practices and healthy lifestyles with those youngsters, because as we know, they're kind of at risk for those things. So
yeah. Do you find that that back to school time before they even get back into school is the best time to bring your kids in for sort of some of those preventative screenings?
I think it is, just because I think people have more time when it's not in school.
Yeah.
I think it's not rushed, because the school nurse will say, little Johnny needs his or her shot before next Monday's basketball practice, or he can't play. Well, it's Thursday, and what do we do? So I think if you do it during the summer, call the school, get the shot records, get that stuff figured out. It's a little more easygoing, not quite as rushed, and we don't miss things that way.
Absolutely. That makes a lot of sense. It's actually time for our first break here, but don't let it make you sick. When we come back, we're going to talk about how to stay healthy year-round. We're also going to talk with Dr. Scott Renshaw about the connections between stress and illness. Keep it right here. You're listening to Chat with the Experts, brought to you by Angie's List.
Introducing the all-new Angie's List app, your on-the-go resource for great local service. Wherever you are, whatever you're doing, you can access ratings and reviews, shop offers, and request scheduling assistance from the palm of your hand. Submit and stay up to date on your projects. Redesigned and easy to use, the new Angie's List app makes getting more from your membership simple and convenient. Anytime, anywhere. Download the free Angie's List app on iTunes today.